because this fruit been come out a big bag been come out the men we should say the fruits don't dry.
Yebufona narrates her experience battling a disease called locally Bigfoot. She was called names for a condition her community had no explanation for.
Then go say you witch, they jam, they come on our nets.
Officially known as lymphatic filariasis or LF. This is one of several diseases that constitute what is referred to as neglected tropical diseases or NTDs. They are known to mostly affect people in poor and neglected communities. According to the World Health Organization, an estimated more than 1 billion people are affected by NTDs worldwide, with many requiring some form of preventive or curative interventions. Over 200,000 people die annually due to one of these diseases, the UN Health Agency says. Most of these cases and deaths are in tropical countries. Africa carries 40% of the burden of NTDs globally, according to WHO. In Sierra Leone, Helen Keller International has been at the forefront of efforts against NTDs, working in collaboration with the Ministry of Health and other local and international partners.
The Neglected Tropical Diseases Program of the Ministry of Health, with funding from the United States Agency for International Development through Helen Keller, has achieved tremendous success in the control and elimination of NTDs in Sierra Leone.
Helen Keller International says Yebu is one of millions of people who have benefited from these interventions. Some of these traveled from their communities across Sierra Leone to join their benefactors in commemorating the World NTDs Day 2024. The event started with a 3-kilometer walk from the Aberdeen roundabout to the Lumley Golf Club, culminating in a stakeholders engagement that discussed progress and challenges facing efforts against NTDs. There are about a dozen diseases categorized as NTDs. In Sierra Leone, the government and its partners focus on 4, including LF, which is also known as elephantiasis. There is also onchocerciasis or onco, also known as river blindness, schistosomiasis, and soil-transmitted ailments, which are worms.
All the 16 districts are endemic for LF, Bigfoot, or you can call it elephantiasis. All the 16 districts. 14 out of the 16 districts are endemic for onchocerciasis, or you can call it river blindness. 9 out of the 16 districts are endemic for schistosomiasis or bilharzia. All the 16 districts are endemic for soil-transmitted ailments.
LF and onco are targeted for elimination, while schistosomiasis and soil-transmitted ailments are targeted for control. Experts say the latter mainly affect children due to their play habit, making it difficult for elimination. However, WHO's new NTDs guidelines recommend for the elimination of schistosomiasis as a public health threat. The government's strategy is through mass drug administration, which is conducted annually across the country for all 4 NTDs. And official data reveals positive outcome for these efforts over the last decade. It shows that Sierra Leone is on the verge of eliminating LF in 15 of the 16 districts, with the exception of Bombali. It gets better with onco, for which no new case of blindness was recorded in the last 10 years, according to information attributed to the National Eye Care Program.
Through the mass drug administration strategy, we have targeted eligible individuals above 5 years, providing integrated free treatment of lymphatic filariasis, onco, and soil-transmitted ailments. Remarkably, over 5.2 million eligible people have benefited from this integrated treatment, and 500,000 school-aged children has received treatment for schistosomiasis annually.
We know that we have the partnership of the NGOs, international and national, that are supporting this process. And of course, we are diagnosing our patients better now, quicker and faster, and we have 18 million less people who are on treatment for NTDs.
Some of the beneficiaries of this effort share their experiences with Mano reporters.
Well, then go from program now with village. I didn't get for see me. Then call me, they ask me. So when I get this problem, now I say, now so them born me. Now they say that they put on. For more than put on, I don't see difference.
Me, now belly buzzing I've been get. They don't do operation. They don't mend me now. Now they feel free now. I no suspect no other sick again around me. They buy the medicine there. They use they do small. So I appreciate too much.
This is the 4th time the World Neglected Tropical Diseases Day has been commemorated since 2021, when the 74th World Health Assembly declared January 30th as a day to raise awareness on these diseases. The theme for this year's event is Unite, Act, Eliminate.
Today, we come together to reflect on the remarkable strides made in the battle against neglected tropical diseases and to call upon all stakeholders to unite, act, eliminate these diseases, particularly here in our country, Sierra Leone.
But in some endemic countries like Sierra Leone, challenges posed by local realities are hindering efforts towards elimination and control.
Africa carries 40% of the burden of NTDs globally, so we need to work towards that. And of course, we know we have the NTD roadmap 2021 to 2030. We need to work on that so we can eliminate the NTDs. Last year, the Kigali Declaration was made where all our heads of state were, and they agreed. And then, of course, the individuals, you as an individual, as communities, we need to come together to say we want to end NTDs and we want to have a better life for everybody.
A key partner in the campaign against NTDs in Sierra Leone is USAID, through whose funding support the country has attained these successes.
You know, USAID, US government, we're committed to working with the Sierra Leone government to eliminate or achieve sustained control of these 4 NTDs by 2030. We remain committed to the broader health goals in Sierra Leone.
Backed by such committed donor support, as well as advancement in technology in dealing with the diagnosis and treatment, the Sierra Leone government and its partners will now have to focus on other issues that hinder progress against these diseases. And a huge part of this is awareness on preventive measures.